My name is Lisa McDowell, and this is my story. I work as a learning consultant at the Orlando Health Institute for Learning. I work in the simulation department. I have worked for Orlando Health for 15 years. I started out at Dr. Phillips Hospital in the Med-Surg unit, and I dealt a lot with the oncology patients there. 2 years ago, I was diagnosed with stage 4B endometrial cancer and had to undergo surgery and then subsequent chemotherapy. After I had my surgery, the doctor came in to give me the diagnosis of what my cancer was. Typically, stage 4B has a 5-year lifespan. I looked at her and said, I don't accept that. I actually had a reaction to the Taxol that I was given. And because of my knowledge as a chemotherapy nurse, I knew some of the reaction that was going to happen with this drug. And the nurse came over, I alerted her what was going on. She came over and she walked me through what was going to happen, and it went straight from the flushing to all of a sudden it felt like there was an elephant sitting on my chest and I couldn't breathe, and it felt like I was about to have a heart attack and I was going to die right there in front of my mother. It was very emotional. And then it went straight from my chest to the nurse said, you're going to start to feel this in your kidneys. And then as it progressed through my system, it went straight down into my legs to the point it felt like my bones were actually breaking. It was so painful. After I had started the chemo, I knew there was something that I could control with this cancer, and one of those things I could control was my hair. And so when I started to notice that it was starting to come out a little bit, I decided to have a head shaving party. I invited a friend over, I invited my sister, my family, my mom, my dad were all there, and we all took turns. They took turns shaving parts of my head. One of the great things about working at the Institute for Learning is everybody's here to help, encouraging me to look ahead.
It's about future, and we talked a lot about what are you going to do tomorrow? What are you going to do a year from now? What are you going to do 5 years from now? And it was about being alive and the future for her.
Because I was hospitalized many times, I had the perspective that our patients have. And one of the things I was able to see is what they see from us. Simulation helps nurses to critically think, to evaluate what's going on in the environment in which they are working. We have a one-way glass, we have a control room, so they can actually perform in the simulation lab as if it is really their work environment on the unit at any of our hospitals. We're looking at the interpersonal skills. If we're working with a team, how are they working as a team? What's the teamwork dynamic? So we ask them to reflect upon their experience to improve their knowledge, their skills, and their thinking. So right now I'm almost 2 years free and clear of cancer. I don't really keep looking back. I'm looking forward so I can focus on my future, utilizing what I learned as a patient when I was in the hospital. So now I can teach our future nurses how to provide effective patient care.